Today we are sitting with Dr. Avnish Seth, who is a leading gastroenterologist of India, and he has been a pioneer in FMT, that is fecal matter transplant, and he is the first doctor who has started this in India. So thank you, doctor, for your valuable time. So, Doctor, what is FMT and how did you come upon this idea? I mean, this phenomenon, this line of treatment. When did you think about it first?
I thought about it about 2 years ago when I was in Prague for an international conference on inflammatory bowel disease. And there was some discussion on a possible role of FMT for ulcerative colitis. Okay. And in our country, we have so many patients who are struggling despite the normal medications. And we are thinking of either colectomy or infliximab, the costly option, a lot of side effects. And stool is something which is available in plenty. Indians are the second largest stool producers in the world per person. Our stool weighs the second largest.
Interesting.
So there's a lot of stool available.
Interesting.
So we thought, why not do it and see.
Okay, great. So, the question which comes after this.
You can also sit. Yeah.
The question just after comes this is: do you see the end of the traditional line of treatment, that is infliximab or the surgery? Do you see the foreseeable future wherein the patient will not have to suffer through all these dangerous things?
Some fortunate ones respond to FMT.
Okay.
We still do not know who is going to respond and who will not.
Okay.
In the trials in the Western world, 25%, 30% people respond.
Okay.
In our own little experience, we have seen almost half the patients respond quite well.
Okay.
So what we feel generally is that it is the donor that decides response and not the recipient.
Okay.
If the donor has the missing link, which the recipient has a deficiency of, if a donor has the same bacteria which are missing in the recipient, only then it is going to work.
Okay.
So it's all, right now it's all a fair amount of luck whether it's going to work or not.
Mm-hmm.
What we are trying to do is get some science into it rather than luck.
Mm-hmm.
If we are able to test the recipient's stool and see what all are deficient, find a suitable donor who has those bacteria which are deficient in the recipient, and only then do the transplant.
Okay. And the next thing is, do we consider this FMT as a treatment or is some method which puts the patient in remission? That is, it is not a one-time cure or it is a repeated thing.
We don't know.
Okay.
There are more unanswered questions than we have answers for FMT as of now.
Okay.
We do not know how many sessions we should do ideally.
Okay.
We do not know whether we should withdraw drugs or not completely.
Okay.
Whether we should withdraw only the drug which have side effects. So all these answers will come as time goes on, because now trials will happen all over the world.
Okay. And in your own personal capacity, what time do you, it is not very accurate to ask you, will you be able to see in mid-term or short-term wherein you will be starting some information and the conclusive evidence about it?
Yes, we have already presented our first patient in the national conference.
Okay.
We are in the process of publishing that report. We have enrolled our 10 patients for the initial trial, which was sanctioned in our hospital free of cost.
Okay.
And now we are looking for some more trials on the same subject, and not only for ulcerative colitis, for irritable bowel syndrome also.
Okay.
There is some data which is coming in. I think this is a very exciting new field of medicine.
Okay.
And more indications are bound to develop.
Okay. And what is the protocol wherein you take up a patient as for the FMT procedure? What is the protocol? What is the
we have developed a do-it-yourself kind of kit at home for everyone.
Okay.
Because we don't mix and do all the procedure of making the stool in the hospital. So we ask the family to do it at home and they bring it in an ice box. So that is how we are different from most other protocols being followed in the world.
Okay.
And right now we are giving 3 sessions at every 2 weeks.
Okay.
But we'll, I think, have a relook at our protocol as more and more data is available.
Okay. Okay.
But one thing I definitely feel that the patients that we have recruited, the 10 patients, they all have very advanced disease.
Okay.
They are all patients who have been suffering for years together.
Okay.
They have tried their 5-ASA, the Mesacol and related drugs. They have been on azathioprine. They can't do without steroids. So we have selected a very sick population of patients who have advanced disease for a long period of time. So the general feeling now to most of us in the world is that why not do it early? Why do we want to wait for someone to reach that stage?
Exactly, and that is what, I mean, a lot of patients who are in touch with me, they are from down south, places like Pune, Mumbai, and they are asking me, they keep on asking me why, I mean, it is not happening in Mumbai, as the city as cosmopolitan as Mumbai, and in the big hospitals. So, do you see in your fraternity people are getting, they will be getting more open-minded, like?
Yes, I think people are getting very excited about it.
Okay.
But the only thing is we have to remember that FMT is not something to be taken casually. Okay. FMT is not something that one can offer just to anybody. There are still more questions to it than answers, and it should be done only as a research protocol in a proper hospital setting with clearance from ethical committees.
Okay.
So that if there is any side effect happening, we should know.
All right. So related to this is the next question is the people who are doing, I mean, they are willing, when the doctors are now doing it in some places, people are willing to do it by themselves in the home, and there are so many videos available on the YouTube. So do you recommend people doing, I mean, this at home, or like you said that they should be under the supervision of the doctor?
Yes, because we still do not know. We don't want anyone to get into a situation where there is a harm. So till something is established, once we know that, okay, if there is fever, you take crocin tablet, it is safe. The whole world can take it on their own, not a problem.
Yeah.
But with FMT, there are too many ifs and buts.
Okay.
Whether some side effect will develop, what will happen after 2 years, after 5 years, we do not know. Okay. So we would definitely not recommend. But what we want to tell everyone, especially in those countries where they are very strict about laws and allowing these kind of trials, is that if you make the laws very strict, people will go ahead and do it themselves.
Yeah.
You can't stop a person who's suffering from trying out a treatment which is likely to benefit.
Yeah, he's desperate for.
So all the countries where the laws are very strict and they want to impose too many restrictions on FMT. Okay. So there's a lot of confusion in the world actually. Some people thought that FMT is like a drug, so we should have a drug controllers.
I heard somewhere that FDA has called it a drug, I guess.
They had called it initially, but then there was a lot of resistance, and now they have come back to their original thing that, okay, it's not a drug. Then, it's not actually a transplant. So you don't need an organ transplant kind of sanction from anybody. So the less complicated we make it, but supervised.
True. Very, very, I mean, essential. Very important.
Otherwise, people will go right ahead and do it themselves and land up in a mess with a rectal perforation or something will happen.
True. So, last question is that you are taking up patients from all over India. They want to come to you and they ask for this thing, or you just select patients?
We have inquiries from several countries.
Okay.
And what we tell them is you have to fit into our protocol. You have to earn the FMT. Because our protocol, as I said, is for very advanced ill patients. But now we are hoping for new trials, which we already applied for, where all comers are welcome. Okay. In the future, I would like to see patients with FMT in patients who have ulcerative colitis of less than 1 year duration. Okay. I'm sure if advanced disease people, we have a 50% response, we'll have a much better response. It makes common sense.
Yeah, common sense.
So we should open it for people, but in a controlled trial.
All right. Thank you so much, Doctor, for talking to you, and pleasure. I mean, we'll be in touch with you. So thanks for availability.
Thank you, Bharat.
Thank you so much.
Bye.
Thank you.